Back pain is an unwelcome guest that visits almost everyone at some point. One day you are lifting a box. The next you feel a sharp twinge that stops you in your tracks. Or maybe it's a slow, dull ache that has been your shadow for weeks, making it hard to sit, making it hard to stand, making it hard to lie down comfortably. This pain can change everything. It can turn simple joys, like playing with your kids, into difficult chores. Going for a walk, into difficult chores. You are not alone in this struggle. In fact, back pain is one of the most common reasons people miss work and seek medical help. It is a universal problem, but the solutions are often closer than you think. The goal of this guide is to give you a clear map to understanding your back pain. We will cut through the confusing medical terms and focus on what you really need to know. Think of this as a conversation with a specialist who wants to empower you with knowledge. We will explore why your back might be hurting, and more importantly, what you can do about it. The journey to a pain-free life often starts with understanding the root cause of the problem. This essay will provide you with the tools to begin that journey, helping you make informed decisions about your health and well-being, one step at a time. Throughout this discussion, we will follow a simple and logical path. First, we will look at the most common causes of back pain, from simple muscle strains to more complex issues like disc problems. Then, we will walk through how a doctor typically figures out what is wrong, explaining the tests and questions you can expect. After that, we will dive into a wide range of treatment options, starting with simple things you can do at home, moving on to more advanced medical care. Finally, we will cover the most powerful tool of all, prevention. You will learn how to build a stronger, more resilient back for the long term. It is important to remember that there is hope. The vast majority of back pain cases get better with the right care and a little bit of patience. Your body has an incredible ability to heal, especially when you give it the support it needs. By understanding the problem and taking the right steps, you can regain control and get back to living the life you want to live, free from this unwanted companion. Most back pain is mechanical. This means it comes from the moving parts of your back, muscles, ligaments, joints. Think of your back like a complex machine with many interconnected pieces. When you lift something too heavy, twist your body awkwardly, or sit in a bad posture for too long, you can put too much stress on these parts. This often leads to a muscle strain or a ligament sprain. A muscle strain happens when muscle fibers are stretched too far and tear. A ligament sprain involves the tough bands of tissue that connect your bones. Imagine you're helping a friend move. You bend at your waist, not your knees, to lift a heavy box. Suddenly, you feel a sharp pull in your lower back. Classic muscle strain. Pain can make it hard to stand straight or bend certain ways. The area may be tender to touch. You could get muscle spasms, painful, involuntary cramps. Ligament sprains often occur the same way. Ligaments supporting your spine can be overstretched by a sudden jolt or fall. Slipping on ice, landing hard can cause a sprain. Sprain pain can be deeper and more persistent. Your back might feel unstable, like it could give out. The good news: strains and sprains are usually temporary. Your body heals these soft tissue injuries, especially with rest and care. Between each of your spinal bones, called vertebrae, you have soft, rubbery cushions known as discs. Healthy spinal disc, a bulging disc, a herniated disc pressing on a nerve. These discs act as shock absorbers, protecting your spine from the jolts of daily life, walking, running, jumping. Each disc has a tough outer layer and a soft gel-like center. Sometimes, due to injury or age, the outer layer can weaken. This can cause the soft center to push outward, creating a bulge. This is called a bulging disc. It is like a tire that has a weak spot and starts to bulge out on one side. A more serious issue is a herniated disc, which is also sometimes called a slipped or ruptured disc. This happens when the outer layer of the disc tears, allowing some of the gel-like center to leak out. This leaked material can press on the sensitive nerves that run alongside your spinal column. When a nerve is compressed, it can cause significant pain, numbness, tingling, or weakness. This pain often travels along the path of the nerve. For example, a herniated disc in your lower back can press on the sciatic nerve, causing sharp shooting pain down your leg, a condition known as sciatica. Let's consider a short case. Sarah, a 35-year-old office worker, started feeling a dull ache in her lower back. Over a few weeks, the ache turned into a sharp pain that shot down her right leg all the way to her foot. She also noticed a pins and needles sensation in her toes. Sitting for long periods at her desk made the pain much worse. Her doctor suspected a herniated disc, which was later confirmed by an MRI scan. The disc material was pressing directly on the root of her sciatic nerve, explaining why her symptoms were felt so far away from her actual back. It is important to know that disc problems do not always cause symptoms. Many people have bulging or even herniated discs without ever knowing it, because the disc is not pressing on a nerve. The presence of a disc problem on an imaging test, like an MRI, does not automatically mean it is the source of your pain. A doctor must match the findings on the scan with your specific symptoms. As we get older, our bodies change, and the spine is no exception. These are called degenerative changes. One common example is osteoarthritis of the spine. It's a wear and tear arthritis. Over time, the smooth cartilage covering the ends of your bones and enabling spinal joint motion can wear down. As cartilage thins, bones may rub together. This can cause pain, stiffness, inflammation. Spinal arthritis pain is often deep and aching and worse in the morning or after inactivity. Another common issue is spinal stenosis. Stenosis means narrowing. In spinal stenosis, the spinal canal, the hollow tube in your vertebrae that holds the spinal cord and nerves, narrows. Narrowing can happen because of overgrowth of bone spurs, or thickened ligaments from arthritis. When the canal narrows, it can squeeze the spinal cord and nerves. That compression can cause pain, cramping, numbness, weakness, often in the legs. Think of John, 68. He loves walking, but after about 10 minutes his legs feel heavy and achy. He has to sit on a bench for relief. He also feels better leaning on a shopping cart. John's case is a classic spinal stenosis example. Leaning forward slightly opens the spinal canal, temporarily relieving nerve pressure and easing symptoms, allowing him to walk a bit further before pain returns. Degenerative disc disease is another term you might hear. It's not really a disease, but a description of aging discs. Discs lose water content as you age and become thinner and less flexible. They stop absorbing shock as well, which stresses other parts of the spine. That contributes to arthritis and stenosis. These conditions are common with aging. For many, symptoms can be managed with gentle exercise, physical therapy, lifestyle adjustments. While most back pain is mechanical, it is important to be aware that sometimes the pain can be a sign of a more serious underlying problem. These causes are rare, but they require prompt medical attention. One such cause is an infection in the spine. Bacteria can travel through the bloodstream and settle in a spinal disc or a vertebra. This leads to an infection that typically causes severe, constant back pain not relieved by rest. It is often accompanied by other signs of infection, such as a fever, chills, unexplained weight loss. Another non-spine cause of back pain is an internal organ problem. For example, a kidney stone or a kidney infection can cause sharp, severe flank or lower back pain, usually on one side. This pain often comes in waves and is not affected by movement or position. You might also have other symptoms like pain during urination, nausea, blood in your urine. In very rare cases, back pain can be a symptom of a tumor or cancer. A tumor can start in the spine, or it can spread to the spine from another part of the body, such as breast, lung, prostate. Pain from a spinal tumor is often a deep, gnawing, constant ache, and may be worse at night when lying down. These serious causes are often accompanied by red flag symptoms that require urgent evaluation. Show infographic. Red flags: fever, loss of bladder or bowel control, numbness or weakness that is spreading or worsening, pain unrelenting and not eased by any position. If you have back pain with any of these symptoms, seek medical help right away. For most people, back pain is not life-threatening. Still, knowing these possibilities helps you know when to seek immediate care. When you see a doctor for back pain, the first and most important step is a conversation. This is called taking a medical history, friendly doctor listening, taking notes. Your doctor will ask a series of detailed questions to understand the story of your pain. They will want to know exactly where it hurts, what the pain feels like. Is it sharp, dull, burning, shooting, and how it started. They will ask what makes the pain better and what makes it worse. For example, does sitting for a long time increase the pain? Does walking provide relief? Does lying down provide relief? This information gives your doctor crucial clues about the potential source of the problem. A muscle strain might feel different from the nerve pain of sciatica. Your doctor will also ask about the timing of your pain. Is it worse in the morning and gets better as you move around? This might suggest inflammation or arthritis. Your overall health history is also very important. The doctor will need to know about any past medical conditions, previous back problems, surgeries you have had. After the conversation, your doctor will perform a physical exam. This is a hands-on assessment to test the structures of your back and to see how your body moves. Your doctor will likely ask you to stand, walk on your heels, walk on your toes, and bend in different directions, forward, backward, side to side. They are observing your range of motion and looking for any movements that trigger your pain. They will also feel along your spine and the muscles of your back, checking for areas of tenderness, tightness, muscle spasms. The physical exam will also include tests for nerve function. Your doctor may check your reflexes by tapping your knee or ankle with a small rubber hammer. They might test the strength in your leg muscles by asking you to push or pull against their hand. They will also check for any changes in sensation by lightly touching your legs and feet to see if you have any areas of numbness. Tingling. One common test is the straight leg raise, where you lie on your back and the doctor gently lifts your leg. If this movement causes pain to shoot down your leg, it can be a sign of a herniated disc pressing on a nerve. After the history and physical exam, your doctor will have a good idea of what might be causing your back pain. In many cases, especially for simple muscle strains, no further testing is needed. However, if the doctor suspects a more specific problem, like a herniated disc or spinal stenosis, they might recommend an imaging test. The most common first imaging test is an X-ray. An X-ray is very good at showing bones. It can help your doctor see the alignment of your spine, check for fractures, identify significant arthritis, identify bone spurs. If more detail is needed, your doctor might order an MRI. Split screen, X-ray on one side and MRI on the other. An MRI uses a powerful magnet and radio waves to create detailed images of bones and soft tissues. It is the best test for seeing discs, nerves, the spinal cord. An MRI can show a bulging or herniated disc and whether it's pressing on a nerve. Doctors usually order an MRI only if symptoms suggest a nerve problem or if pain hasn't improved after weeks of treatment. During the evaluation, the doctor looks for red flags. Red flags are signs of a serious, urgent condition. They require immediate attention. Red flag, fever or chills, possible infection. Red flag, loss of bowel or bladder control. Red flag, numbness in the saddle area. These signs can indicate cauda equina syndrome, where nerves at the base of the spine are compressed, requiring emergency surgery. Other red flags, unexplained weight loss, history of cancer, pain that is severe, constant, and worse at night. Finding a red flag is uncommon, but knowing them helps ensure you get the right care at the right time. When back pain first strikes, your initial response at home can make a significant difference. The old advice used to be complete bed rest, but we now know that is often the worst thing you can do. Instead, the goal is to modify your activity. This means avoiding the specific movements that cause sharp pain, like heavy lifting and twisting, but continuing to move gently. Light walking is, one of the best things you can do. It keeps your blood flowing, prevents stiffness, and helps your back muscles stay active without putting too much strain on them. For the first 24 to 48 hours after an injury, applying ice can be very helpful. Ice works by constricting blood vessels, which helps to reduce swelling, reduce inflammation, and numb the sharp pain. After the first couple of days, or for a chronic dull ache that does not involve a lot of swelling, switching to heat can be more beneficial. Heat does the opposite of ice. It increases blood flow to the area. This increased circulation brings more oxygen and nutrients to the sore muscles, which can help them heal and relax. Heat is also great for relieving muscle stiffness and spasms. You can use a heating pad, a warm towel, or take a warm bath or shower. The key is to listen to your body. Some people find that alternating between ice and heat works best for them. There is no single right answer, and what feels best to you is likely what is most helpful. How you hold your body throughout the day and night has a massive impact on the health of your spine. Poor posture is a common contributor to back pain, especially the chronic, nagging kind. The first step to improving your posture is simply to become aware of it. Try to sit up straight, with your shoulders back, and your feet flat on the floor. Use a small pillow or a rolled-up towel to support the natural curve of your lower back. If you have to stand for long periods, try placing one foot on a low stool, and switch feet every so often. Sleep is another critical time for your back. Sleeping on your stomach is generally the worst position for your back. It forces your neck to be turned to one side for hours, and can cause your lower back to arch unnaturally, putting strain on your spine. The best positions are usually sleeping on your back or on your side. If you sleep on your back, placing a pillow under your knees can help maintain the natural curve of your lower back. If you are a side sleeper, try to keep your legs slightly bent and place a pillow between your knees. This helps to keep your hips, pelvis, and spine in better alignment. Finding the right sleep setup can help your back muscles fully relax and recover overnight, allowing you to wake up feeling refreshed instead of stiff and sore. Over-the-counter medications can be a helpful tool. The most common types for back pain are non-steroidal anti-inflammatory drugs, or NSAIDs. This group includes medications like ibuprofen, naproxen. As their name suggests, these drugs work by reducing inflammation, which is often a key component of back pain, especially after a strain or sprain. It is very important to use these medications wisely. They are meant to be a temporary bridge, not a long-term solution. The goal is to reduce your pain enough so that you can stay active, do your gentle exercises, and give your body a chance to heal. One of the most powerful tools for treating and preventing back pain is exercise. A good starting point is the cat-cow stretch. On your hands and knees, gently round your back up toward the ceiling like a cat, then slowly arch it downwards into the cow. Another foundational exercise is the partial crunch. Lying on your back with your knees bent and feet flat on the floor, place your hands under the small of your back for support. Gently lift your head and shoulders off the floor without straining your neck. This strengthens your core muscles. Strong core muscles act like a natural corset, providing stability and support for your lower back. For pain lasting more than a couple of weeks or more severe, doctors often recommend physical therapy. A physical therapist is a movement expert who can design a personalized exercise program for your condition. They also provide hands-on therapy, massage to release tight muscles, and joint mobilization to improve spinal movement. A big part of their job is education. They teach you about your condition, show how to maintain good posture during daily activities, and give tools to manage symptoms and prevent recurrence. When conservative treatments do not provide enough relief, your doctor might suggest a more targeted approach. One common option is a steroid injection. The most common type of injection for back pain is an epidural steroid injection. During this procedure, a doctor uses an X-ray machine to guide a thin needle to the epidural space in your spine. Once the needle is in the right place, the doctor injects a mixture of the steroid and a local anesthetic, numbing medicine. An injection is not a cure. It's a tool to manage symptoms so you can function better and participate more effectively in physical therapy. By breaking the cycle of severe pain, an injection can create a window of opportunity to strengthen your back, which is the real long-term solution. The last resort. Understanding back surgery. Surgery is almost always considered the last resort for back pain. Surgery is typically reserved for very specific situations where there is a clear structural problem that can be fixed, and when all non-surgical treatments have failed to provide relief over a significant period. For a herniated disc that is severely compressing a nerve, a surgeon might perform a microdiscectomy. In this procedure, the surgeon removes only the portion of the disc that is pressing on the nerve, leaving the rest of the disc intact. For spinal stenosis, a procedure called a laminectomy might be done. This involves removing a small piece of bone from the back of the vertebra to create more space in the spinal canal, relieving pressure on the spinal cord and nerves. Recovery from back surgery can also be a long process, often requiring weeks of rehabilitation, months of rehabilitation, physical therapy to regain strength and function. Before agreeing to surgery, it is essential to be sure you have exhausted all other reasonable options. It is often a good idea to get a second opinion from another surgeon to confirm that surgery is the right choice for you. Building a resilient back, the power of prevention. The most effective way to deal with back pain is to prevent it from happening in the first place. One of the most important factors is maintaining a healthy weight. Regular exercise is the cornerstone of prevention. Focus on strengthening your core muscles, the abdomen, back, and pelvis. Planks, bird dog, bridges. Add regular aerobic exercise, walking, swimming, cycling. Daily habits in your work environment matter, ergonomics. Chair with good lumbar support. Monitor at eye level. Get up and move for a few minutes every half hour. When you lift something, even if light, use proper technique. Keep your back straight. Bend at your knees and hips. Hold the object close to your body. Lift with your legs, not your back. Stop smoking. It reduces blood flow to spinal discs and slows healing. By controlling your weight, staying strong and active, and moving wisely, you are creating a suit of armor for your back. This proactive approach is the most powerful tool you have to live a life free from the limitations of back pain. We have traveled a comprehensive journey through the world of back pain, starting with its common causes and ending with powerful prevention strategies. This understanding of the why behind your pain is the first step toward taking control. The journey to relief is a stepwise process that begins with you. This tiered approach ensures you start with the safest, least invasive options first. Your path forward starts today with small, manageable actions. Try a gentle stretch, go for a short walk, or adjust your chair for better posture. Remember, your body is designed to heal, and movement is often the best medicine. You are not defined by your back pain. By understanding its causes and embracing a proactive approach, you can build a stronger, more resilient back and reclaim a life of activity and joy.